Hi, my name is Marc Laniado. I'm a consultant urologist, and now I'm going to talk about Retzius-sparing prostatectomy. So what is a Retzius-sparing prostatectomy? Well, it's a treatment for early prostate cancer. You've probably heard about robotic prostatectomy, radical prostatectomy. Robotic prostatectomy is a technique in which a robot is used to help remove the prostate gland. There are various approaches to it. The standard approach is to go in front of the bladder to release the prostate. An alternative way is to go behind the bladder. By going behind the bladder, preserve many of the attachments necessary for bladder control. So Retzius-sparing prostatectomy is a way of removing the prostate for men who have early prostate cancer that enables them to regain bladder control faster than the standard way of doing the procedure. Now, the indications for this are early prostate cancer. It tends to be cancer that's of grade group 2 or 3 and confined to the prostate gland, sometimes on both sides. Now, a Retzius-sparing prostatectomy can be combined with nerve sparing using a special technique called NeuroSAFE. Now, traditionally, as surgeons, when we remove the prostate, we do it because we want to get rid of cancer. There's cancer there, so we need to be rid of it. We don't want to die from prostate cancer, obviously. However, there can be side effects to that treatment, and one of those side effects is loss of erections. Now, to preserve erections, we need to keep the nerves at the sides of the prostate. But when we remove the prostate for prostate cancer, we don't want to leave cancer behind. So sometimes we have to take some of the nervous tissue at the same time as removing the prostate, because we cannot tell at the time of the surgery whether there's cancer in the nerves. So a way around that problem is something called NeuroSAFE. Now, with NeuroSAFE, what we do is we intentionally remove the prostate and preserve all the nerves needed for erection. And we get a report on the surgical specimen we've removed, telling us if there's any cancer on the edges which we might have left behind. So during the operation, we have the opportunity then to remove nervous tissue if needed, if there's cancer still there. Now you may say, well, why can't you do that anyway? Well, the risk is during the operation, normally we cannot tell if there's cancer on the edge because you only get the reports about 1 or 2 weeks later. So with NeuroSAFE, we get the information during the operation itself, which enables us to intentionally preserve nerves, knowing that we can remove the tissue if the cancer is involved. That way, we can offer more men nerve sparing, which will help men preserve their erections. So if we combine a Retzius-sparing prostatectomy, which preserves the structures needed for continence better, together with NeuroSAFE, that enables us potentially to save nerves more safely, we can ensure that we remove the cancer yet improve quality of life. We can keep bladder control being excellent, hopefully, and we can also help recover erections. Now, furthermore, there's an additional maneuver you can do to improve the quality of life for someone having a prostatectomy. So instead of using a catheter in the penis to drain urine, we need that catheter there to allow the reconstruction between the bladder and the urethra to heal. We can use a tube that goes out to the lower belly called a suprapubic catheter. By having a tube in the lower belly rather than in the penis, it means that it's more comfortable during the recovery phase after the operation. Usually a catheter stays in place for about 7 days after the surgery. So by having it coming through the lower belly as a suprapubic tube and not in the urethra, not in the penis, it means that you can have an easier recovery. It's also safer, and it means that you can test whether someone can pass urine after 7 days after the surgery more easily and with greater reliance. So all in all, a Retzius-sparing prostatectomy combined with NeuroSAFE and a suprapubic catheter gives you a very good chance of being rid of the cancer, yet preserving bladder control and hopefully erections, and makes it a very viable and effective way to remove prostate cancer, and so hopefully extend someone's life who would otherwise have had a shortened life from prostate cancer.